Hello, everyone. So today I will be speaking about Dr. Jane Watson and her theory of human caring. So Dr. Watson was born in West Virginia in 1940. Our textbook states 1939, but her website as well as other resources state June of 1940. She was the youngest child of eight, and she grew up in a small community in West Virginia. And being the youngest child, she paid attention to what was going on around her in terms of different human dimensions and complexities of life and suffering and so forth. So, this kind of led her to having a more compassionate personality, and this will play a part later in her life. She went into nursing by default, kind of because her father suddenly died when she was 16 years old, and this influenced her in terms of dealing with loss and grief, and so it inspired her to go into nursing school. She received her BSN from University of Colorado in 1964, then her master's in 1966, and continued her PhD in 1973. She now holds 16 honorary doctoral degrees, including 13 international honorary doctorates. She's the founder of Center of Human Caring in Colorado, fellow of the American Academy of Nursing, former president of the National League of Nursing. She's a founding member of International Association in Human Caring and International Caritas Consortium. She's the founder and director of the Watson Caring Science Institute, and she's now inducted Living Legend by the American Academy of Nursing. She's also authored and co-authored over 30 books. So, Grand Theory. Grand theory is known as the form of highly abstract theorizing in which the formal organization and arrangement of concepts takes priority over the understanding of the social reality. Now, the philosophy and science of caring has four major concepts. These concepts could also be known as a meta paradigm, and they include the human being, which is the valued of a person of him or herself to be cared for, respected, nurtured, understood, and assisted. In general, it's a philosophical view of a person and a fully functional, integrated self. Secondly, we have health, and Dr. Watson actually adds three of the following elements to the World Health Organization's development of health, and those elements include a high level of overall physical and mental and social functioning, a general adaptive maintenance level of daily functioning, and third, the absence of illness or the presence of efforts that leads to the absence of illness. Next, we have the environment and society. According to Dr. Watson, caring and nursing has existed in every society. A caring attitude is not transmitted from generation to generation, but it is transmitted by culture of the profession as a unique way of coping with its environment. Lastly, we have nursing. Nursing is a concern with promoting health, preventing illness, caring for the sick, and restoring health. It focuses on health promotion and treatment of disease. Dr. Watson does believe that holistic healthcare is central to the practice of caring and nursing, and she has defined nursing in the past as a human science of persons and human health illness experiences that are mediated by professional, personal, scientific, aesthetic, and ethical human transactions. So here's an image of the nursing paradigm. Again, it includes all four of the different elements. And Dr. Watson's philosophy and science of caring is concerned with how nurses express care to their patients. Her theory stresses the humanistic aspect of nursing as they intertwine with the scientific knowledge and practice of nursing. This is an image of Dr. Watson's conceptual model. I think it's really interesting how everything intertwines together, everything from the nurse to the patient, including their mind, their body, their soul, and how everything in caring, healing, and the connection of the high energy of the universe all falls within love and a sacred space for compassion and just a transpersonal caring relationship between the nurse and the patient. So I really enjoyed this conceptual model. Watson's hierarchy of theory is similar to Maslow's hierarchy of needs, and they include the lower order biophysical needs and survival. These are basically the need for fluid, food, elimination, and ventilation. Next, we have the lower order of psychophysical needs or social functioning, and these include the need for activity, inactivity, and sexuality. Next, we have the higher order of psychosocial needs or integrative needs, which is the higher order integrative needs that are achievement and affiliation. Followed, we have the higher order of intrapersonal needs and growth seeking. And this is the need for self actualization. And that's how I tied them both to Maslow's hierarchy of needs. So Dr. Jean Watson had 10 curative factors. These 10 included forming humanistic altruistic system values. They include instilling faith and hope, cultivating a sensitivity to self and others. They include developing a helping trust relationship, and this later was changed into a different title, and it is now known as the development of helping trusting human caring relation, and that was done in 2004. Next, we have the promoting an expression of feelings. We have using problem solving for decision making, promoting teaching and learning, promoting a supportive environment, assisting with the gratification of human needs, and last, allowing for existential phenomenological, I can't say this word, phenomenological forces. And so on the right, I have an image of her mission statement and how all of these all play together with the patient and the family and with all of the different relationships together. Dr. Watson's assumptions include caring can be effectively demonstrated and practiced only interpersonally. Secondly, we have caring consists of curative factors that result in the satisfaction of certain human needs. Third, effective caring promotes health and individual or family growth. Fourth, caring responses accept the patient as he or she is now, as well as what he or she may become. Fifth, we have a caring environment offers the development of potential while allowing the patient to choose the best action for themselves at any given point in time. And sixth, the science of caring is complementary to the science of curing. And last, the practice of caring is central to nursing. And these are assumptions that you can make based off of Dr. Watson's model because, I mean, the process seems very straightforward, but all in all, unless it's actually put into place, these remain assumptions. Lastly, these are my references, and thank you everyone for viewing my presentation.